All right, great. I'm not sure if everyone heard our introduction there, but for those of you who didn't hear it, we first came into contact with Dr. Chadi through our membership with the Association for Multidisciplinary Education and Research in Substance Abuse, or AMERSA. He is a pediatrician and clinician investigator specialized in adolescent and addiction medicine, also a clinical assistant professor for the Department of Pediatrics at St. Justine University Hospital Center at the University of Montreal. So with that, Dr. Chadi, I will pass it over to you.
Thank you very much. I hope that everyone can see my slides. It should be working. I just shared my screen. So let's just dive right in. We have lots to talk about today, and hopefully this is going to be useful and interesting to all of you. So the outline I'm suggesting for today is to start by talking just a little bit about substance use in the adolescent brain, looking at some general trends in adolescent substance use, but spending most of the time discussing the neurobiology and physiology of the most commonly used substances in adolescence. So talking about nicotine, marijuana, alcohol, opioids, and then a slur of other substances. And I was asked to leave some time for questions, so I'm definitely planning to do that. I think it might be easiest to keep questions for the end. Also feel free to use the chat box, though I might not be glancing at it while I talk. All right, so I think that many of you working in the field have heard about the adolescent brain in different talks and different settings, but I'd like to stage all of my discussions with a quick recap and just talk a little bit about how the history of knowledge about the brain has evolved. So we used to think that brains stopped getting bigger and better around age 10 to 12. We've known that for centuries, that actually the brain stops getting heavier around that time. But it's only more recently that we've noticed that there's actually quite a bit of development that continues well into the third decade of life, so into the 20s. And what we've started understanding more since we've had electronic microscopy giving us images of brain cells at this level is that at birth we start with very few brain cells, and there's this exponential growth of brain cells around ages 3 to 6 and 7, early childhood years. And then during adolescence, what happens is that we're really just selecting and keeping those brain connections and those neurons that we need the most for the rest of our life. And the metaphor that I like to use, and I use that with a lot of the families and patients I work with, is that brain development is a lot like joining Facebook. So please humor me just for a moment here. When you join Facebook, you have very little, if any, friends at all, or connections, right? And then you meet people and add people and then end up with so many connections that you actually can't really remember who's who. You don't really need or use all these connections. So you start kind of cleaning up your friend list and end up with the most important connections that you'll actually be using. And so brain development is a lot like that. And so adolescence is a little bit like cleaning your friend list and making sure you're keeping those connections that you're going to be needing for the rest of your life. And so another way of looking at this is looking at colorful functional magnetic resonance imaging images that show that different areas of the brain grow and develop at different rates and at different times. So what we can see here is that the front parts of the brain, or the prefrontal cortex, is really one of those last parts of the brain to fully mature. And that is the part of the brain that helps us to make rational decisions and plan things and weigh the pros and cons of something that might be a little bit riskier or more dangerous. And so there is what I like to think a rational thinking gap around the adolescent years, meaning that some parts of the brain, one of those being the nucleus accumbens, or the reward and pleasure center of the brain, fully functional, working very well in a 12, 13, 14-year-old who can perceive and get the full benefits of something that's pleasurable and enjoyable. But in the meantime, those rational parts of the brain are just not there. So there's this biological predisposition to try riskier things, to do things that give you a big reward without being able to weigh the potential consequences of doing that. And you know, I'm going to show just one or two more brain slides here. One thing that's very important to know when we're talking about adolescent substance use is that there is a so-called common pathway that helps us perceive reward. That's true in adolescents and that's true in adults. And so what is depicted here is that this red circle with the yellow dots is the epicenter where the dopamine or pleasure hormone gets fired out. And then we have brain cells and connections that are latched directly onto that nucleus and help the brain sense the effects of different substances like alcohol or nicotine or even illicit drugs like cocaine or heroin. And when you're a teen and you're in that process of selecting your brain connections, of cleaning up your friends list, if you get stimulation from any or all of those substances, what happens is that you are reinforcing this reward pathway and this sensitivity to perceive reward and feeling good from drugs and alcohol. So that probably has a lot to do with the fact that if you're exposed to one substance, your vulnerability to using other substances is much greater. And that's especially true if you're a teen or young adult with a brain that is still changing and evolving. And so we have a lot of statistics showing how this concretely has an impact on how much more vulnerable young people are versus older people if they start using alcohol or marijuana, for example, at a younger age. And so what we've noticed is that if a 13-year-old starts drinking alcohol, there is a 5 times greater risk that this person will have an alcohol problem in their lifetime. And there's a similar relationship with alcohol and marijuana if we compare a 13-year-old with a 21-year-old. So someone of legal age who would start using alcohol or drugs has a similar risk as the general population of having substance use problems. And that is true for alcohol, marijuana, and all sorts of other substances, meaning that there is a great advantage and need to delay as much as possible the onset of substance use based on many things, and one of them being that the brain is still changing and you don't want to sensitize this reward pathway to things like alcohol and marijuana when the brain is still really trying to figure out what's going to be more useful for the rest of lifetime. And so kind of the last metaphor that I'll use here is that brain development is a little bit like building your house in some ways. And so adolescents have a house that has foundations, but still has very fragile walls and structures that need to be solidified with a good roof and good walls. And so an adolescent is much more vulnerable to the sweeping effect of substances when exposed young. Okay, so that was my little intro about the brain. I wanted to show us some very general trends nationwide when it comes to the most commonly used substances. And I think this just kind of to give us some points there, some reference points for the rest of the talk. So these stats are from the Monitoring the Future survey. The latest results just came out a few weeks ago from 2019. And what we are seeing is that there's some good news in there. One of them is that alcohol use in young people is declining and has been declining for several years now. So young people or teens now in high school, in middle school, are binge drinking or drinking alcohol, yes, less than say 10, 20, or 30 years ago. The one big trend that is changing the scenario here is nicotine used through electronic cigarettes. And so really, we've been living in a bubble if we haven't heard about everything around vaping and juuling and these nifty little devices. And so we're at a point now where e-cigarette use is a much more common way of using nicotine than traditional cigarettes in high schoolers and middle schoolers. And so cigarette smoking, a little bit like alcohol, but more dramatically, has been decreasing steadily for 30 years. And this trend of decreasing nicotine use is being challenged by the arrival of electronic cigarettes that are really taking most of the space here. And we're now seeing more daily nicotine vapors than cigarette smokers. And so it's not just experimentation with e-cigarettes, it's also regular daily use. When it comes to marijuana, things have been pretty stable. There's been a lot of questioning, and I think a lot of folks here, if not all of you, are from Colorado. So, and I'm in Canada now, where we've legalized nationwide. I think a lot of discussion about what would legalization of medical and recreational marijuana do to youth rates of use. And what we're seeing generally is that past year use of marijuana stays pretty stable in places where marijuana has been legalized. But there tends to be a little bit of an increase in terms of daily users of marijuana. So that's definitely one trend that needs to be followed nationwide, and also in places where marijuana is legal. some other good news is that illicit drugs, and then we can take marijuana aside from that in that lower curve there, has been decreasing for the past 10 to 20 years. So street drugs are less common in young people. And so this is one trend, even though we talk a lot about opioids and about fentanyl and these overdose producing drugs, they tend to be used less and less in young people under the age of 18. And this is just an example of that. So Vicodin and OxyContin, the two most commonly misused prescription opioids, have been really, really trending down significantly in the past 10 years. Similar thing with prescription stimulants. So stimulants tend to be used in high school students, tends to be used a lot in young adults. We are seeing in the US a decrease in misuse of these drugs, so Adderall being one of them, and then Ritalin or other ones being some other stimulants. Based where I'm at in Canada, it's still pretty stable. So I'm not as convinced that the trend is significantly and consistently going down for prescription stimulants, but this is what we're seeing with the most recent stats. All right, I'm going to shift gears, stop talking about statistics, and dig deeper in what I really want to talk to you about today, is how these different substances specifically affect the adolescent developing brain and body. So let's just start focusing on alcohol for a second. So the first question is, which part of the brain or what parts of the brain are affected by alcohol? And so when I ask that question, I get all sorts of different responses, but really it's a trick question because it's all of the brain. And why is that? It's simply because alcohol has a depressing effect on all of the brain cells because of its action on a very non-specific receptor called GABA. And so we've heard a lot about the effects of alcohol on, how it can affect liver and increase your cholesterol and perhaps cause cancer and all those things. One thing that we tend to not necessarily talk so much about is that alcohol has a very different effect on the brain of an adolescent compared to the effect on the brain of an adult. And these funny little rat pictures here are just to show that if you give an adolescent rat, for example, and I would translate that to human beings, we happen to do a lot of substance use research in animals for ethical reasons, but what this study here depicted showed is that an adolescent rat or an adolescent person who is given alcohol will tend to have a stimulating effect at first, but still get all the decreases in coordination, in motor function that you would see in anyone using alcohol. So the big problem with that is that a young person using alcohol may perceive that they are feeling good and energetic and do very risky things, the main example being driving while under the influence of alcohol. Well, this is less likely to happen in an adult who would tend to yawn a little bit earlier, feel tired when using alcohol. And the perfect example is, as an adult, drinking a glass of wine is often followed by a yawn, but that doesn't seem to happen as reliably in young people who seem to want to go dance and party at first. And so one thing that has been studied when we're talking about the chronic effects of alcohol on the adolescent brain is that, yes, binge drinking, which is the most common way of drinking in teens, tends to impact different key areas of the brain, not unlike most other substances, actually. And so if you'll let me for a second, this is an interesting study that looked at the brains of young people who were trying to match little squiggly line patterns while lying down in an MRI scan. And what the study showed is that if you compared 16-year-olds who are somewhat regular binge drinkers, so on weekends would have more than 4 or 5 drinks in a sitting, to non-drinkers, if they are 16 and do this, they'll pretty much both be able to get all the answers right, but the brain of a heavy drinker will be working a little bit harder to get to the same conclusions. This study goes a little bit further and repeated the experiment 4 years later, and the non-drinkers remained non-drinkers, and the heavy drinkers remained heavy drinkers. The very interesting thing that happened here is that heavy drinkers started making mistakes, while non-drinkers got all the answers right, and then it was a flipped picture where heavy drinkers had a lot less brain activity. And why is that? Simply because some of their brain cells had been triaged out or eliminated by the effect of chronic alcohol and binge drinking. And so we can see this in other studies comparing different areas of the brain that tend to become thinner and thinner with binge drinking over the course of several years. I'm just going to ask everyone who's not talking to mute their microphone, please, because I'm hearing some background noise, and that might be disturbing for some folks. Thank you, everyone. All right. And so I guess, you know, the key point here is that I mentioned most alcohol consumption happens in the context of a binge when we're a young person. It's very rare that adolescents will have 1 or 2 drinks a night in the way that is potentially healthy in some ways. And really, it is binge drinking that has this sledgehammer effect on the brain. So we need to be mindful of that when thinking about the chronic effects of alcohol, especially in young people. All right. So I wanted to focus on the brain effects of alcohol because I think that we do hear a lot about some other chronic effects of alcohol in the brain and body. And I will now shift gears. I'm going pretty quickly here because we don't have all that much time, but hopefully this is going to still be useful. I want to focus on nicotine now because there's a lot of talk about it because of the so-called vaping epidemic. And so I tried to create a little smart graph here to depict where are we at now in 2019 in terms of what young people are using when we're thinking about all nicotine and tobacco products? So the e-cigarette bubble is the largest one, and these other bubbles are a little bit smaller. But what I think is important to keep in mind is that adolescents still do use all sorts of other tobacco products, including cigars and hookah pipes and chewable, dissolvable tobacco, cigarettes as well. And all of these tobacco products have their own risk profiles, and all of them do contain nicotine and harmful chemicals that can potentially lead to cancer risk long term. So let's focus just on a second on how nicotine can affect the brain. So we know that nicotine is a very quickly acting substance that reaches the brain within seconds after inhalation, and effects tend to last approximately 30 minutes. That would be true for someone smoking a cigarette or vaping nicotine with an electronic cigarette. What happens when nicotine flows through the bloodstream is that it affects not only the brain, but also those adrenal glands, those very important glands on top of our kidneys that release a hormone called epinephrine that can increase alertness, blood pressure, and heart rate. At the level of the brain, there are specific acetylcholine receptors that are activated by nicotine. And then there are some downstream effects. Dopamine, or pleasure hormone, gets released, and then some other ones like serotonin and glutamate that have an effect on things like mood and pain and pleasure. Nicotine is highly, highly addictive, more so than alcohol and cannabis, and at a similar level to cocaine, just a little bit under things like opioids, heroin, fentanyl. And that's largely because it acts so quickly and creates this big spike in dopamine, which makes the substance very addictive. So, you know, in other words, nicotine enters the brain through the bloodstream, reaches this dopamine firing center that I mentioned, and then that dopamine gets released in the rest of the brain. And in the body, we see these glands that I was talking about over the kidneys that release some hormones that also have some effects on how our heart and our blood gets pumped through the body. Where it gets a little bit trickier is trying to talk about the longer term effects of nicotine. And so although we've had cigarettes for so many years, it is very difficult to isolate the specific effect of nicotine on the brain of an adolescent using the research designs that we have available for ethical reasons. So that said, we still know most of what we know about the long-term effects of nicotine based on animal research done in rats and other animals. And so what we do know is nicotine does produce persistent and long-term changes in different key areas of the brain. And those areas tend to be involved with things like addiction, no surprise here, I talked about that common pathway, but also in very important tasks and functions such as attention and working memory. And we also know that nicotine affects those areas of the brain that have something to do with impulse control and mood regulation. And those effects tend to be negative long-term and to a certain extent irreversible. And so that may seem a little bit counterintuitive to some of you, because I just said that short-term nicotine is a bit of a stimulant that wakes you up. So how can it be that long-term it impairs your attention capacity and your memory? Well, just because perhaps of this overstimulation short-term that has an impact on how the brain should develop in those areas, and then eventually having a kind of a counter effect. And so the big question is, Are e-cigarettes really a gateway drug, or any form of nicotine, really? Well, what we do know is that a lot of young people using e-cigarettes with nicotine now are a new group of young people who probably would not have used nicotine in cigarettes or other tobacco products. We do know that using an e-cigarette is linked to using a traditional cigarette and other tobacco products, and we also know that there are strong associations between using nicotine in an e-cigarette and then marijuana and other illicit drugs. And this all makes sense based on what I was talking about with this common pathway where there's a sensitivity to this idea of feeling pleasure from a drug that comes from the use of it during adolescent years. Okay, and so I wanted to show just very quickly what is the difference between nicotine effect and then nicotine withdrawal. Because when you work with young people who start using nicotine regularly, what we see is that, yes, short-term nicotine can have this increased alertness effect and then will maybe reduce appetite and create faster heartbeats and then higher blood pressure. But ultimately, because nicotine is such a short-acting substance, within a few hours of not using it, there will be withdrawal symptoms, and that looks like headaches, anxiety, irritability, difficulty concentrating, feeling restless and hungry and tremorous and sweaty and dizzy. If you're thinking of a young person trying to focus on schoolwork or on a 3-hour exam, these are not good. Same with going to track practice or rowing practice. So really, nicotine is an addictive substance that also can lead to a lot of withdrawal effects that come relatively quickly. And as I said here on the slide, within 4 to 24 hours, you get them and you get them strong, sometimes less than that. And then the symptoms will peak up to the 3rd day after the last use and then eventually taper off. Okay. Something that we're starting to see a lot more now with e-cigarettes, which we did not see with traditional cigarettes, is the so-called nicotine toxicity syndrome, which happens when young people or teens being teens try to challenge themselves to use as much nicotine as they can in a small amount of time. With e-cigarettes, you can do that, especially if it tastes like fruits or dessert. And so getting the equivalent of an entire pack of cigarettes in a 15-20 minute period will lead you to have intense stomach or abdominal pain, feeling very dizzy, having buzzing headaches, not being able to focus, and some patients will go to throwing up and really not having a good time for several hours. And I have a lot of teens telling me that in clinic. So this is definitely a new side of nicotine that we're now just starting to see with these high concentration vaping products. So I will shift gears towards marijuana, and you'll see there's a lot of overlap with nicotine and marijuana now because of these e-cigarette and vaping devices. And so we hear a lot about THC, this kind of psychoactive part of marijuana that gets a lot of press. But the unfortunate thing is that anandamide is really the all-star player here. We all currently have anandamide flowing through our brains and bodies. And this is our natural form of cannabinoids, or cannabis-related molecules, that actually have a very important role in our bodies. So I'll come back to that in a second. Cannabis, a plant, there are different strains, there are different active ingredients or molecules that are in it. The most commonly talked about are THC, I just mentioned, that can get you high or get you the kind of euphoric effects. And then CBD, that also does have some effect on how the brain functions, but tends to be something smoother that also may have some anti-inflammatory or anti-anxiety properties. There are also 100+ other molecules that have effects that go somewhere between THC and CBD. And our bodies are wired to receive those cannabinoid molecules in our brains and in the rest of our body using CB1 or CB2 type receptors. And I just pictured different strains of marijuana here, with the sativa, indica brands being the most common ones, sativa tending to be a little bit more activating and indica tending to be a little bit more depressing. So I mentioned that anandamide, our own natural cannabinoid molecule, is so important. And why is that? Because we have what is called an endocannabinoid system, which is our own body's volume control nudge to help regulate those signals that are useful when we get them, but that we don't want to keep forever. Example, you're hungry. Your brain tells you, go eat. You've eaten your piece of pizza or your sandwich or your salad. You don't need to feel hungry anymore. Cannabinoids help us turn down that system and get back to a resting kind of state. And that is true with things like motivation and pleasure and pain and other very vital functions that we have. We also know that cannabinoids are involved in memory forming and memory formation. So very important roles all around. And if you look at where our cannabinoid receptors, those receptors that will attach to THC or other forms of cannabis, are in the brain, you see in the prefrontal part of the brain, you see in the C-shaped area, that is where we form all our memories. This is the reward center. The back is our cerebellum, where we get all the coordination and motor function. So yes, cannabis can definitely disrupt all these very important functions that happen in these areas. And so what I like to compare anandamide and THC as is it's a little bit like you're trying to, fine tune and develop your brain with a scalpel, doing a very fine surgical job. But then THC comes in and starts acting like a sledgehammer, banging on different areas of the brain and doing a very kind of grotesque job in keeping and stimulating those areas of the brain that need to strengthen and become better and bigger with adolescent development. And another thing that's happening is that marijuana is becoming more and more potent with the years. And this is a trend that doesn't seem to be slowing down. And shown here is the average concentration of THC in a smoked marijuana joint. And so we don't have the most recent number, but we're around 15 to 18%, which is a lot more than it was a generation ago. So marijuana is now becoming more concentrated with, you would imagine, stronger effects on the brain and body as well. So I'm going to skip a little bit over this, but this just goes to say that yes, marijuana can produce some very pleasant and euphorical effects short term. A lot of young people will also get some very negative effects right away, be it with the first use or repeated use. And all of these things can happen: feeling paranoid, anxious, irritable, having memory problems, poor attention and judgment, and distorted spatial perceptions, and all those things. And research done in Boston, where I was working up until last year, showed that about 40% of young people who use marijuana report paranoia or hallucination. So very severe negative effects in using marijuana. So it's not the exception. And the effects of marijuana, the positive ones like the negative ones, usually tend to last a lot longer than nicotine and can last overnight, producing what we call sort of like a hangover effect. And so there's more and more research now compiling the longer term, well, the short term and the longer term effects of heavy marijuana use. And what seems to be clear now is that if you do use marijuana over the course of several years during your teen years, you will have a decrease in your IQ that ranges anywhere between 5 to 7 points, which is significant. And in grade point average can be compared to having a B plus to a B minus average or something like that. There are definitely associations between marijuana use and having lower kind of educational potential and job potential and life satisfaction. And so the list goes on, and it's hard to say that using marijuana will cause these things, because this does require very specific types of research designs. But when we see such strong associations that are across the board and being repeated and repeated, there are strong reasons to say that marijuana contributes to all of those things. And so when we talk about mental health, which is something that we hear a lot about, regular marijuana use during your teen years will increase risks of serious mental health problems like psychosis, schizophrenia, anxiety, and depression 2 to 5 times. And I would add that this is even stronger if there is a family history of mental health problems or of substance use that predisposes the brain to kind of go towards those problems. Very quickly, we're seeing more young people having what is called cannabis hyperemesis syndrome. So using a lot of marijuana and strong marijuana can lead to uncontrollable vomiting, which sometimes gets misdiagnosed as other things like gastroenteritis or different types of migraines that can give you vomiting. But this is something that we're seeing more and more. So yes, the vomiting control center is in our brain. And so marijuana does act in that part of the brain as well. And the only real treatment so far is to stop using marijuana. And I will only mention this briefly, but yes, marijuana also has all sorts of effects on not just the brain, but also the body. So lungs, depending on how we're consuming it, if it's combusted, then there are other chemicals involved. There are several effects on fertility and sexual function, which might be something that teenagers are concerned about, and obviously some effects on heart rate, and then possibly on weight control. Marijuana does tend to increase appetite quite a bit. And then just like nicotine, marijuana can cause pretty significant withdrawal symptoms. So if you stop using marijuana after using it for a long while, you will get restless, anxious, irritable, angry. You'll have a harder time falling asleep. You might get nightmares. Your appetite's going to decrease and your weight might decrease, which are all things that might make it very difficult for a young person to quit using. And if parents aren't aware, might think that their teens are just being grumpy when they're actually trying to quit using marijuana, which is an important thing to tell families. One big question, medical marijuana, what to do about it? Well, you know, marijuana does bring a lot of promise. I think one thing to keep in mind is the term medical marijuana does not come from the medical community. It comes from the industry, which very astutely figure that we can use marijuana for many medical things. Doesn't mean that it necessarily medically works. So THC possibly can have some effects on pain and different side effects linked to cancer, for example, and CBD is associated with, I mentioned, antioxidant or anti-inflammatory properties, and with young people with very severe seizures can be helpful. And then if you combine them together, other opportunities potentially are opening. But really, we need a lot more research, because the way young people are using so-called medical marijuana is not the way that is studied in scientific research. So we don't really know yet how it actually works and affects the developing brain the way that young people are using it. And it becomes a very tricky balancing act. So because there's such limited research on the safety of currently available medical marijuana, and only very few indications that are FDA approved, and the two in young people are side effects from chemo and seizures, and people are very refractory seizures that don't respond to medication. And then with CBD, there's a lot of THC mixed into those products most of the time. So it's really hard to know what's what. And so it becomes a very big game of weighing the pros and cons. And I would argue that in most cases with young people, the potential cons usually outweigh the benefits, at least in the way that most young people are using them, and based on the very little bit of knowledge that we actually have on how to do it properly. What happens when we mix nicotine and THC? That happens a lot in vaping devices nowadays. About a third of young people who vape have used their e-cigarette to vape marijuana, and most of them have used nicotine. So we know that nicotine and cannabis together makes the addiction stronger. So marijuana, less addictive than nicotine, mix it with nicotine, you make them both more addictive. And then sometimes they can increase the properties of one another. Nicotine is more rapidly absorbed, so it can help cannabis be more rapidly absorbed. So you see where I'm going there. And then you get potentially the withdrawal symptoms from one and both. It becomes more complicated. And yes, I mentioned that vaping is a good vehicle for high potency nicotine and THC products, and those are just some examples. But young people tend to be attracted by something that's strong and powerful, because that is something that goes with adolescence, this feeling of invincibility that goes with this reward-seeking tendency. And so these high nicotine and THC products are very concerning in young people because of the effects they can have, definitely on the brain. I'll shift gears and talk about opioids a little bit, and we are getting towards the end so that we can have time for questions. How do opioids work, and why do we even need opioids? Well, actually, we really do need opioids because we have receptors for those types of molecules that help us perceive pain and pleasure and satisfaction. And so, yes, opioids are important, and we have our own naturally occurring opioids that circulate in the body. And so where do opioids work? They work in the frontal part of the brain, and those deeper parts of the brain, and the brainstem, and the spinal cord, so on and so forth. And so when an opioid comes in, what happens very rapidly is that we develop a tolerance, and then we build more receptors to be able to respond to the opioids and to the effects that they give. Very rapidly, opioids, when are not in circulation, produce a strong withdrawal feeling that is quite unpleasant, and can be addressed by using medications like buprenorphine or Suboxone. I'm showing this for opioids, but this would have been relevant with other substances like nicotine and marijuana. But we just know that opioids, you can develop a very quick and high tolerance to very quickly. And so what do you do with young people who develop an opioid addiction? We do actually have quite a few solutions. So there are medications that we know can work quite well to help young people counteract that withdrawal and you know, switch from addiction to street opioids or uncontrolled prescription opioids to things like medications at controlled doses that can work very well. So definitely there is hope in a way that there isn't necessarily for marijuana, where we actually don't have good medications to help us with marijuana addiction. And yes, very important when we're working with young people who potentially are using opioids or other substances, we have to think about overdose. And naloxone is something that is very accessible now and very easy to use that can help reverse overdoses. Yes, in young people, we know that a fraction of all overdoses, it's not the majority, but do happen in people that are under the age of 18 or 21. So we need to think about recommending young people who might be gravitating in circles where people are using opioids to have naloxone, the Narcan spray, or the injections handy so that it can be used when needed. And yes, it saves lives. All right. Quickly, other substances. I mentioned stimulants in the introduction when I was talking about trends. So there are different types of stimulants. Well, caffeine is the most common one, and then prescription stimulants used as medications for ADHD, and then illicit or street stimulants like cocaine and meth. And those tend to be used by adolescents. The prescription stimulant is the I guess, probably the most commonly occurring tricky one to deal with teens. It's approximately 5% of high school students who will misuse, and then university students a lot more. There's a very tricky balance here because we know that young people who have ADHD and don't get good treatment for it are at much higher risk of having a substance use problem later on in their life. But that there is obviously a risk of misuse with those medications. So we have to be careful in making sure that we do prescribe those medications to young people with ADHD in a very controlled way so that we actually reduce their risk of using drugs or misusing those stimulants, and then ultimately reduce the rates of misuse in the population. And what are some of the risks with stimulant use? Well, stimulants act on the heart, and a lot of stimulants will make the heart beat a lot faster, and sometimes irregularly, and sometimes stop. And it becomes problematic when we're mixing different substances together, because that can really lead to pretty dangerous heart arrhythmias. Sedatives. This is something that I tend to be seeing a lot more now in my practice, but young people do use prescription or non-prescription sedatives. Most common ones are benzodiazepines, and the commercial names are Xanax or Ativan or Valium, and those are very easy to order at very low cost online or to get from a relative's medication cabinet, and other things like sleep medications or barbiturates, which tend to be less used nowadays. But those are all very, very addictive and cause a very severe withdrawal symptom. So if you stop using them right away, you can actually have seizures and seize so much that you actually can have cardiac arrest. And so aside from these sedatives, only alcohol can give you such a violent withdrawal. Even opioids cannot kill you because of the withdrawal, but sedatives and alcohol can. So these sedatives are definitely something to look out for, and especially because they tend to be mixed with other depressing agents like alcohol, creating a pretty dangerous and lethal combo. Psychedelics is also something that we're hearing more and more because of a tendency towards medical use of them, and even legalization in some parts. And you've heard about that in Colorado. So there is definitely increased interest in young people in trying to use them recreationally. The most common ones are LSD or psilocybin, and there's some other ones. The long-term effects are not very well understood. We do tend to think that those have more transient effect on the brain, but in some cases, using too many of those psychedelics at high doses can actually produce hallucinations or psychosis that does not go away. Some very severe forms of schizophrenia or psychosis, or what is called hallucinogen persisting perception disorder. That's a mouthful. So things to look out for. I'll conclude here. I'm very well aware that this was a whirlwind tour of the world of substance use, but hopefully we can talk a little bit and you got a few things out of it. So A few take-home points. The adolescent brain continues to develop until the mid-20s and is much more vulnerable to addictive substances. Why is that? It's because of this sensitization of this reward pathway, this common route towards developing an addiction in young people who use substances. Alcohol remains today the most commonly used psychoactive substance in young people, and binge drinking carries important short and long-term risks. And I will emphasize that yes, it can definitely impact brain development and cognitive capacities. Nicotine, very addictive, very high potency in these vaping products, and definitely can have significant effects, again, on the body and brain long term. Marijuana use is pretty high in young people. It affects the brain and body in several ways, and we have to be very careful when we think about medical marijuana because of the risks of causing harm. And then prescription opioids and stimulants, decreasing in young people, but do remain a significant concern that does require careful attention. All right, so I'm going to open it up for questions and discussion, and thank you all for your attention. This is where I'm from, not at this time of the year, unfortunately. All right, so I'm going to try to open the chat box. Let's see if I can do that. Stop sharing. All right. So I'm not too sure how we should go for questions. I don't see any questions in the chat box, but please do feel free to ask anything about what I said or anything unrelated to my talk as well. And make sure to unmute your microphone if you want to speak. There's a question about being able to get a copy of my slides. I confirm that that is absolutely possible. I've shared my slides already, so you're all welcome to have a copy of them.
Yeah, we will be sending out the slides to everyone after this presentation, so it's very important that if you have not already put your name, agency, and email address into the chat box, please make sure to do so. Also, if you have any questions and you don't feel comfortable unmuting yourself and asking them, feel free to ask them in the chat box and we can convey them to Dr. Chadi.
I'll ask a question. My name's Jennifer. I'm in Montrose, Colorado. I have a patient who has been on Concerta and then probably about a year and a half ago switched to Adderall, but a pretty big number of years on stimulants for ADHD. And he has recently, as a sophomore in high school, decided that he's ready to stop those stimulants because he finds marijuana is much more effective at helping his focus. And I used a lot of different comments and strategies with him, but I didn't know if you had any, whether for my knowledge base or to impart to him any way to conceptualize that for him where he could understand that that's not the best idea long term moving forward.
This is a great question. This actually happens a lot in my practice as well. I have a lot of teens that come to me and say that they use marijuana to counter some of the side effects of their stimulant medications. So I think the first question might be to ask the young person, why is it that they think marijuana works better for them, or what is it that they like better versus the medication? There really is no indication that marijuana can help cognitive capacities at all. For people that might be extremely anxious or extremely depressed, short term, marijuana will get them high, so it'll help with that, of course, and I won't argue against that. And for some people, marijuana can help you fall asleep, but it probably won't increase your capacity to sleep well. So these are things that I'm very transparent about with young people. And so, and also telling them that long-term marijuana will actually decrease their IQ and their ability to memorize and all those things. So it probably goes with exploring different medications if there are side effects that are unpleasant, possibly changing the doses, or possibly also trying without medication so that they can actually see if there is a difference or not. But it is very tricky. But as far as I know, I haven't seen any forms of medical marijuana that really have been shown to improve academic capacities or attention.
Thank you.
Dr. Chadi, we do have one question so far in the chat box. that says, why isn't there a lot of information on the long-term effects of psychedelics, and what's impending research on those substances?
I like this question. I was just at a very good session about this, talking about the cutting edge research. Well, first of all, psychedelics are controlled substances, meaning that there are a lot of hoops to jump through if we want to study them medically. What is actually very interesting is if you look at the addictive potential of all the drugs out there, psychedelics are extremely low, meaning that they're not addictive at all if they're used in kind of their pure form. And so there aren't that many known side effects long-term with psychedelics. I think that because you can develop a tolerance to them very quickly, they aren't substances that would make sense to use like a daily medication. Those studies out there that look at using LSD or psilocybin to mushrooms for things like depression or PTSD look at use over the course of 1 or 2 sessions, and then how that might help your mental health long term. So we're not talking about how regular daily use of psychedelics can impact the brain, which would be very difficult to study, and maybe there's no point in doing that because there probably isn't necessarily an indication to use them regularly anyways. So all that to say that we need more research to know what's really going on. It seems that they are less addictive substances than many other drugs, that if they are used the wrong way can lead to psychosis or hallucinations or things that would spiral your mental health out of control, but potentially could be helpful in some ways. So I think we're going to hear a lot more about psychedelics in the years to come. But with young people with a developing brain, we have to be careful. Young people being young people, they can use psychedelics with other substances. They can use it way too often and go down that hill where it actually will be quite harmful for them to do so. Okay. I'm seeing another question here, so I think I'm just going to go ahead and read it. What is your response to a patient who is using THC to treat their anxiety? A little bit what I was just saying. In the moment, pretty much anyone, not everyone, because some people do respond very negatively to marijuana or THC, but a lot of people will get a high and will feel good after using THC. And I am very transparent about that with young people, because if I try to tell them the opposite, they'll be like, this doctor's very wrong, and he knows nothing about marijuana. So because THC has those euphorical effects, short term makes you feel good. Where the reflection is and needs to be had is, how does the young person feel several hours after using? And there's usually a crunch and a dip, and you don't feel so good. So you see your mood and your anxiety kind of spiraling or fluctuating, which becomes harder to deal with. And then you become reliant on always using THC or regularly using THC to control your anxiety. And then it comes to this whole question about what are the other side effects and long-term effects of using THC for things like anxiety control. And what I was trying to tell you is that it actually impairs your cognitive capacity and your memory. And those are all things that I'm going to tell the young person. We have other medications and we have very effective ways of doing therapy for anxiety that have very little side effects, or sometimes no side effects at all if we're talking about therapy, which would be a much more effective way to deal with anxiety than using things like THC. There is research about potential forms or ways of making THC less harmful or better used for young people or adults. We're not there yet. Maybe it might be a little different in 20, 30 years when we found the right combo or the right way of doing this. But as of now, THC used the way that it's being used by young people is definitely not the most effective way of treating anxiety and has a lot of side effects. Any other questions? I don't see any more in the chat box.
All right, well, if there's any more, there's one more question it looks like just popped up.
Okay. Do you consider around 25 to still be the age that a young person's brain is developed? Yeah, that's a good question. We know that brain development kind of starts slowing down mid-20s. So, you know, some research will say that women tend to develop a little bit quicker than men, you know, so maybe early 20s versus later 20s. I think it's fair enough to say that, you know, around the age of 25 is a time where kind of the rational part of the brain is better equipped to deal with the incentives of using addictive substances. I think a good example of that is when we talk about e-cigarettes, and I'll dive into that for just a second. A very controversial topic nowadays. Can we use e-cigarettes for smoking cessation? Well, perhaps that for, you know, people who are 25 and older, it could be a way of reducing your nicotine intake and switching to a less harmful product. It doesn't hold true for people that are under 25, and I think this is really a good example of how, because the brain is still very sensitive to things like nicotine, and e-cigarettes being this very effective vehicle of nicotine transmission or consumption, it doesn't work as well. So young people under the age of 25 trying to use an e-cigarette to reduce their nicotine consumption will most of the time go to using more of it or using multiple forms of nicotine, because their rational part isn't just, it doesn't have that like fine tuning or that final bit of development that allows to really think rationally and do this critical thinking that is needed to resist the very, you know, addictive you know, signals and impulses that come from substance use. So I would say that yes, 25 is a good general kind of ballpark figure. And does that mean harm reduction is not an effective intervention for substance use in minors? Oh, well, thank you for asking that. My disclosure is that I'm Canadian, and I'm a huge fan of harm reduction. I think it's very, very important. There is a time and place for promotion of abstinence or delaying onset of substance use, but the world being what it is, young people probably in the foreseeable future will continue using substances, and there is definitely a huge advantage to those young people using less harmful, less concentrated, less intense forms of substances while their brain is still changing. So harm reduction is a very, very broad term that involves all sorts of things, like using less harmful substances or less of the substances, or in settings where use is not tied to as many complications or health problems. No, I think we need all sorts of approaches to help reduce and prevent and delay substance use in young people, and harm reduction is definitely one that has shown promise. And you know, it also allows you to have a very sensitive discussion with young people. So if you're working one-on-one with a young person with substance use problems using motivational interviewing, for example, a harm reduction approach is usually a very useful kind of first step in trying to understand their reality and negotiating, coming to some terms where you might actually be reducing the risk of overdose or very harmful use when they're not ready to start to quit using altogether. So I would say that harm reduction, you know, on the contrary, is very important and potentially quite effective in young people. With the caveat that, you know, because the brain is still immature, you know, there's always the potential that things will get more harmful before they become less harmful.
All right, great. Well, thank you so much, Dr. Chadi. I will leave the chat box open in case anybody else has not entered their name, information, or email address, or if they have a question for Dr. Chadi that we weren't able to get to today. I'll leave the chat box open here for a couple more minutes. But otherwise, we want to thank everybody for being here, and of course, thank Dr. Chadi for his insight and input. Thank you all, and have a great day.
Thank you, everyone. All right, take care.